Hello, and thanks for listening to the MiCare Champion Cast. If you're a regular listener, it'll come as no surprise that Michigan hospitals are there for our communities in ways that reach far beyond the bedside. Just last month, we released our 2024 Community Impact Report, which highlights some of the ways hospitals are strengthening the healthcare workforce, enhancing access to care, and building healthier communities in nearly every region of the state. This work reflects a simple theme: hospitals help. With this in mind, today's episode will focus on an effort at Corewell Health that's helping enhance care and improve health outcomes for those who experience homelessness. Joining me virtually, I have Dr. Laura Ortiz, who is an emergency medicine physician at Corewell Health William Beaumont University Hospital. Dr. Ortiz is the Director of Faculty Development and the Fellowship Director of the Medical Education Fellowship. She also serves as the Assistant Medical Director for the Street Medicine Oakland program, which is what we'll learn more about in today's episode. Dr. Ortiz, welcome to the podcast. Thank you for being here.
Thank you. I'm happy to be here.
Well, I should have said this before, but I did not know you were expecting, so I want to first say congratulations. I read your bio and I was like, wait a second. But I also want to ask the question of how you are surviving as a doctor and a mom without coffee.
Yeah, I don't drink coffee at baseline, even when I'm not pregnant. I've never been a caffeine drinker.
You know what's strange is you're not the first doctor to tell me that. Is that like a thing?
No, I feel like I'm a weirdo when I don't drink coffee. Like, I would love that I did if I did, because it's such a cultural thing. You know, everyone's like, "Oh, let's go grab a cup of coffee." I'll be like, "Well, I can go with you, but I won't drink it." You know, I'll get a hot chocolate or
right.
At Starbucks, I joke I get like a milkshake. There's like a blended cream frappuccino. So I don't drink coffee. I don't drink any caffeine. I don't drink pop. I don't drink energy drinks. So I ingest no caffeine. I just really prioritize sleep. And then I think I just barely function otherwise.
Well, that's amazing. Then I won't feel guilty if my Diet Coke makes it into frame while we talk. That's very impressive that you're able to do that. So thank you for being here today. I want to start by learning more about you. I provided some background on where you come from and your role, but can you give us some more details on what led you to this field and why you chose healthcare?
Yeah, so I always joke when people ask me that. I used to watch that show ER on TV, like in the 90s, and I thought they were so cool. And that's what I was like, that's what I want to do. I'm going to live in Chicago, and I'm going to save lives every 3 minutes, because that's like how often they're saving a life on the show. But I realized it's not actually what it's like, and I had no desire to live in a city. I prefer the suburbs of Detroit. But I was always thinking doctor from like when I was a kid, and then I was trying to figure out in college like what that meant and why it aligned with the things that I liked in my life. And I did a lot of teaching in college. I was a TA for many different courses, and I really liked educating people, whether it be on chemistry, biology, or whatever I was TAing on. And I really liked people learning and understanding the same joy that I found in these specific subjects. And you could tailor that to medicine because you're always learning and you're always teaching, whether you're teaching medical students, medical residents, or even your own patients, different things about their healthcare. It's always really rewarding to kind of make that connection and make people excited about the same things that you're passionate about. And then I've always enjoyed service. I just like doing the right thing for people and helping out people when you can. It just seems like the right thing to do. And so when I was younger, you know, I volunteered at various things with like through my church or through my school or whatever. And so in college, I explored volunteering more in the medical field and really found like the patient interactions rewarding. And so kind of all of that led me to be like, yes, medicine's the right fit for me. And then I went to medical school locally, and probably I try to keep an open mind about what other specialty I might want to do, but emergency medicine just was the right field for me. I liked doing a lot of different things. I like doing procedures, using my hands. I like being the first person to see a patient and figure out what's wrong with them, if I can, act as a detective. And then you're seeing patients usually on their worst day. And you can be like that calming presence to help reassure them or help save them or whatever. And sometimes you don't find anything scary or emergent, which is good. And then you can reassure them. And then you also, in the emergency department, you deal with everything. So you deal with babies, you deal with the elderly, you deal with everything in between. So you still have that whole gamut of patients. And then you're the last resort for some people, or like the only access some people have to healthcare. And so sometimes you can see like really sad chronic stuff, but you can help to try to navigate the system and see like how you can overcome barriers, which actually is what led me to street medicine, is because I didn't know enough about what else was out there. I know when we have patients that come in that are experiencing social determinants of health and maybe have are experiencing some homelessness or something like that, our typical thing is, oh, here, let's give them a list of shelters and they can go figure it out.
Right.
But it didn't seem right. And it's actually not that easy just to go figure it out. So street medicine has really given me like an opportunity to really see the other side. And I feel like I am probably a lot more empathetic of a physician and a lot better a physician because of my experience with street medicine.
Absolutely. Yeah. And I'm excited to learn more about the program. And that's obviously why you're here today. And I think it's really important that we tee up the conversation talking about the reality of healthcare for vulnerable communities and specifically people who experience homelessness. And you could speak to this better than I could, but I know just based on some research that those who face homelessness are facing higher rates of chronic illness, mental health issues, substance use disorders, high rates of emergency department visits, which you would know most about, and mortality. So can you speak to that and just as a healthcare provider, take some time to touch on why social determinants play such a huge role in our health?
Yeah, so they're pretty big predictors of health outcomes. And if we ignore them, we kind of are leading to ineffective interventions. It's like focusing only on treating the symptoms without addressing the root cause of the problem. Fixing someone's trouble breathing, but not actually fixing like what caused the trouble breathing. So if we don't do that, we're not really improving people's health. And social determinants of health, they all contribute to health inequities. And people from marginalized communities face greater barriers to accessing resources and opportunities that promote health. And then you end up seeing, like you said, experiencing higher rates of chronic disease, disability, premature death. And I think, particularly the homeless population, the access is the issue. And a lot of it is from just an insurance standpoint, but some people do have insurance. There's not enough people who accept necessarily the type of insurance that they have. And then it's, I think, navigating the system as well. It's difficult. Even as a physician, it's very hard to navigate and to know what to do. Patients who aren't, and people in general who don't have as much medical background, you don't always know what your next step is. And so that's what the emergency department comes to, because a lot of times you're like, well, I have access to a physician. I can ask them about my problems. But there are, there's a huge mistrust in the community of medicine. And I think some of it stems from things that we have done as a medical society and, research studies or experiments that we have done that have stemmed the mistrust. And I think we need to work on overcoming that. And as a result, marginalized communities don't seek out the healthcare because they don't necessarily trust it as much. And there's cultural barriers as well. Our Western society has very different takes on medication than maybe some of the Eastern cultures. So that also creates kind of like a mistrust or maybe not seeking out care. And again, that can become like, that can be a social determinant of health as well. If you can't communicate or a physician is not understanding what you're doing.
When you say that, it made me think of the fact that, just to allude to your point before, you have patients who probably come in and think, well, all the doctor's going to do, or don't come in because they think all the doctor's going to do is hand them a pamphlet versus, assessing the situation or meeting them where they are, which is what it sounds like Street Medicine Oakland is all about. It's meeting those vulnerable patients where they are. So can you tell us about the program, just an overview of how it works and how it came to be?
The idea of street medicine actually began in the early 1990s with a physician in Pittsburgh. He observed that due to various barriers that we're kind of started talking about, the homeless patients were unable to access and navigate existing healthcare service. And so he developed street medicine as a way to meet these individuals where they are at. So it's like reality-based healthcare and understanding what your patient's reality is and seeing what they face daily. Because again, it can be really easy to say, just do this or just, why don't you just do this? But if you don't see the barriers and what patients are experiencing, you can't understand how hard it is to just do this, what seems like a simple thing for you. Just call your doctor. But if they don't have access to a phone, they don't have access to transportation, their next appointment's not for 6 months, and they don't even know where they're going to be in 6 months. It's just really hard to make that establishment. So since he started the street medicine as an idea and as a program, it has grown exponentially over the past, I guess, 30 years. Tons of programs all across the nation. Even in different countries, you have a lot of street medicine programs. So our particular program started in 2019, and we are affiliated with Oakland University, William Beaumont School of Medicine, and then partnered with Corewell Health, William Beaumont University Hospital. And so my partner, Dr. Brian Felice, and I were kind of like the two beginning physicians. He started first and then brought me on board like a month or two later. And so we have two different arms to our approach to street medicine, and it's a little bit different than some of the other programs. In one arm or one way, we go like every other Monday, we're at the Hope Shelter, which is one of the only, actually is the only low barrier shelter in the state of Michigan. And that means that people who don't have ID can still access the shelter. People can be intoxicated and they can still access the shelter. It tries to limit reasons people can't be there.
Right.
So every other Monday we're there. We do a pop-up clinic. We work with the medical students and we see patients. So guests at the shelter, they sign up to see us, and then we are completely free and we see them and try to address whatever concerns that they have and how we can help. We carry mostly over-the-counter medications with us, but we also have some prescription medications that we can hand out to patients right then and there to try to help alleviate the cost of medications and then like the issue of going to a pharmacy and getting them.
Right.
And then every other Saturday, we're on the streets of Pontiac. And so we chose Pontiac partly because of where our school is based. Our school is based in Auburn Hills, Rochester area. And so Pontiac is our closest area that probably has a higher population of homeless patients in Michigan. There's a lot in Detroit, but there's Wayne State is in Detroit, Michigan State is in Detroit. So they have their own street medicine programs there. So we felt that Pontiac had an opportunity for us to go and create this program there. So every other week, we go on the streets and we drive around because Pontiac is, the suburbs of Detroit are not the best for walking.
Right.
So we drive around in our cars to where we know where most of our rough sleepers are. And we hand out lunches that are made by the Baldwin Center, which is another place in Pontiac that is really helpful and one of our partners. But we hand out lunches, and then we try to cross that barrier of if we can provide any sort of health care. Initially, when we first started, we were just handing out lunches. People weren't as interested in the healthcare part. But since we've been doing it for 5 years, almost 6 years, we've been a presence in the community. And so people have started to trust us more and I think be open to healthcare and health interventions. Additionally, we have, in the winter especially, we have a lot of supplies with us, like winter packs. And so that usually has a sleeping bag or gloves, mittens, those warming things that you can go in your hands. And so we hand those out too as well. Yeah. We get donations from people. So we have boots and socks and stuff like that we can also hand out to people. And a lot of times, because we see the same people over and over on the streets, sometimes they can request something. I know one time we saw a woman and she requested some boots in a specific size. And then we went and looked through all of our stuff and got our donations, and we were able to give her boots of her own size because we were able to see her again in a couple of weeks. So those are kind of the two arms of our program. And so we have physicians at each of them. We have medical students at each of them. And we've had a lot of encounters throughout the 5 years.
Yeah, absolutely. And those resources are important year-round, but especially during the dead of Michigan winter, I would imagine. So you mentioned there's a lot of different people involved, and it sounds like, when you need those resources, I would imagine you have to tap other community organizations. So how has partnerships helped really grow this program?
Yeah, we definitely would not be able to function without partnerships. So we got a startup, grant or gift from actually, I think, a DMC fund back in 2019 that funded all of our supplies. that we initially bought. So a blood pressure cuff, an otoscope to look in people's ears, medications, etc. And then we receive regular philanthropy from the emergency department at Corewell Health, William Beaumont University Hospital. And then we have had a really good, since we expanded to outside of just emergency medicine physicians providing this, we also have family medicine physicians from Corewell Health as well that provide medical care. The Southeast Family Medicine Association also gives us a grant or an award almost yearly. We apply for it every year, and so far they've been very generous in that. And then we've also gotten money from MHA. Recently, we just won an award from them as well. So outside of the monetary support that we get, we are paired with Gary Bernstein Clinic, and this is in Pontiac. It is a free clinic for people who don't have insurance. So it's a fantastic clinic. We have had a really strong, close relationship with them for the past 5-6 years that we've been doing this. We store a lot of our stuff there, and then we refer a lot of our patients that don't have insurance to that clinic as well to kind of get more care. And even when I see patients at the hospital, because I know about this clinic, I refer people to them, which I think was helpful.
Right.
We also have a close relationship with Baldwin Center, which I mentioned. They provide us luncheons. We do a lot with, I guess not a lot, but we do a fair amount with Michigan Health Department too, where we go around when we do our street runs. Sometimes they come with us and they give out vaccines. So they're really big on giving out, like when COVID was really, we needed COVID vaccinations. They went around with us and gave out vaccines to anybody who wanted it and didn't have the opportunity to go get it.
Yeah.
And then Honor Health is also another close partner. They have a similar relationship with the guests at Hope Shelter in Pontiac, and they also provide a lot of care there. They accept insurance, but they accept like all varieties of insurance. So a lot of our patients that are under Medicaid or different aspects of Medicaid, we're able to refer them to Honor Health. And then Hope has been probably like the biggest resource is that shelter. It gives us an access to a place that we can, and they've been super supportive, that we can actually provide services to their guests. And then we, in return, use some of the money that we've been gifted to gift to Hope so that they can provide Lyft, kind of Uber, but Lyft, the Lyft version of it. We provide Lyft credits there so patients can get to their doctor's appointments because transportation is a huge issue.
Right.
So, we try to help them with that. And then we have a very good relationship with them helping us be there to help their patients. So all those community partnerships have been super helpful. And I think between our experience at Hope and doing street medicine, Dr. Felice and I have really kind of expanded to understanding, I think, making partnerships with other people who are involved in trying to end homelessness in Oakland County. So we've met a lot of different organizations. So we've had really good partnerships built and just trying to see like what else is out there and how else we can partner and be a part of everything.
Yeah. Yeah. And I don't want to jump the gun, but I do want to just point out on your website that it looks like you have, you make it really easy for people who might be interested in volunteering or donating. So we'll obviously include, a link to the website in the description of the episode so that anybody that is involved in that field or anybody it sounds like the general public or medical students that might be interested in getting involved can do that really easily through the street medicine website. So I'm sure you have many examples just based on the work that you're doing and how many people's lives it touches. I'm sure you have endless examples of the impact of this work, but can you give us a few examples of what you've seen and what has really stuck with you as a physician?
The experiences that we've had, even in just like the data from 2024, we've had at the Hope Shelter alone, we had 23 outreaches, which was about 250 patient encounters. We had 26 street runs. We've seen about 125 patient encounters from that, providing over 400 meals. We provide toiletries and clothes as well. We do a lot of medical care between Hope and the streets. So we do a lot of wellness checks, hypertension management, diabetes management, wound care, vaccine counseling, some chronic pain counseling. And then we've had, over 100 hours of like attending physician volunteering, over 130 hours of resident physician volunteering, and over 500 hours of medical student volunteering. So we've had, kind of a lot of from a numerical side, a lot of impact from that standpoint. I, for some reason, tend to do the Hope Shelter a little bit more. That just ends up being like my volunteering is there. And then my partner tends to do the street runs more. And I know when I've been on a street run before, they talk about Dr. Brian, the patients that we run into, and how wonderful he is. So I think even just that impact is that they know who he is and that they have a really good experience with him. And he has had an experience with a patient on the street that we see him every street run. He's been very reluctant to start like any medications, but he's been having high blood pressure for a very long time. So over months of seeing him, supporting him, checking his vitals, discussing it, building trust, he started taking blood pressure medications and now has much better blood pressure, which will hopefully lead to less like acute issues with high blood pressure, but also less chronic issues, because really high blood pressure is more of an insidious issue. And so hopefully he will prevent long-term damage to his kidneys, his heart, his eyes, everything. So I think that's been like a huge impact, is that just that we were able to be consistent, not pushy, see them and discuss their current concerns and their fears. And we don't have time limits like a typical clinic. We don't have to be seeing multiple patients, because we're not trying to earn a living here. We're just trying to do the right thing and get people help where they need it. And so being able to see someone on a regular basis on the street to show that you are there for them, consistently there for them, you're persistent and you want to help them, I think can eventually help break down that mistrust and help break down those barriers that were preventing him from getting care in general.
It kind of shows how medical mistrust, how deep it goes, because it sounds like this person was seeing Dr. Brian weekly for probably a significant amount of time, but it still took really trusting that provider to take his advice. It wasn't just a one visit, oh, you should take this medicine. It had to be coming from someone that they felt like was actually understood their situation and understood what they needed on a deeper level.
Yeah, and I think people, maybe it's, I don't know, it says something to our society, but I think people are suspicious of altruistic behavior sometimes. Like, what are you trying to get here? What are you trying to get out of me?
Right.
And so I think seeing that weekly or every other week, I guess, that we're just here for them, that there's no underlying motive here. We just want them to get the right help that they need.
Right.
And you just want food today, that's okay. You want to talk today, you want to check your blood pressure, you want to check your blood sugar, we can do that. You don't want to do anything, that's okay. We're just wherever they're at, I think is where we try to meet them. And so I think having that opportunity to see him regularly, to show up regularly, and definitely over time, like trusting the medical students, trusting Dr. Brian Felice as well, and really got through to him. And now he's having at least like a better blood pressure control. So hopefully better effects from that. And I know there was one woman that we were seeing regularly that she was unfortunately very delusional, and hadn't been on any psychiatric medications in a very long time. And a very sweet woman. And we saw her on a regular basis, and she'd be like the one who we'd ask, can we get you anything? And then she would say, oh, maybe a pair of boots or something. She didn't need much from us, but we saw her regularly, gave her food. Eventually, she ended up being hospitalized and got put on psychiatric medications, and now lives in an apartment and is functioning much better, which I think is like an amazing progress. I don't think that necessarily has anything to do with us, but I just know that was one of our patients that we had.
Yeah, I mean, to see those success stories and the people and the journey that they go on, I think that you probably have more of an impact than you're giving yourself credit for, because you're building trust. And, if they decided to take the guidance of a physician when they were in the hospital, maybe that had to do with the way that you treated them and the compassion that you showed. So I would definitely not undermine, the work that you're doing is probably having a huge impact on people's perception of healthcare in general. Any other examples that you would provide?
Those are the biggest two that come to mind. I mean, they're like in the clinic, we've been able, like I've seen patients occasionally at my hospital, and then they happen to be staying at the clinic. So then it's kind of almost continuity of care, because I'm like, oh, I'll be there on Monday.
Right.
So I will see, I can check your wound again and make sure we're like going in the right direction with that.
Right.
So there's a little bit of continuity clinic. The only I guess the only downside is like the location separation between my hospital and Pontiac. There's a couple more hospitals in Pontiac, so patients tend to go there over my hospital, which is so we don't get to see them as frequently at our hospital. But I know I've unfortunately had to send a couple patients to the hospital from the Hope Shelter, but that's just because we didn't have the right resources to take care of them. But I think a lot of times patients just have questions about medications and just being able to answer those, especially with our medical students who are very knowledgeable and eager to, have those interactions and help our patients. They can spend a lot of time talking about different medications and different remedies and different over-the-counter things and other things that we can do outside of just medications.
Yeah, beyond the patients, I wonder what impact you've seen this. What's the reaction been from the medical students and the residents that are involved? I imagine they're learning a lot just being early in their careers about how they can overcome some medical mistrust and what it takes to really treat people with compassion when they're in these unique circumstances.
Yeah, I mean, I think personally for me, just talking about myself, it was eye-opening to understand like how a shelter worked. Because again, it seemed really easy to say, just go to the shelter.
Right.
But there's specific times that you have to be there, to know when you have to check in, to do an intake. There's all kinds of things. So as part of this whole program, we've created a health disparities elective through our emergency department. So our residents, as they go through their medical training, they have the opportunity to do electives, and they can do it in whatever global health, radiology, community emergency medicine. So different options, but one of them could be a health disparities elective. So I've had a couple residents do it. And so one of the projects was for me, I had a resident find all of the shelters that are around in Oakland County, Wayne County, Macomb County, and then figure out how to get into them.
Wow.
Because again, you think it's just, naive because I didn't have that experience of having to try to get into a shelter, how to get into it. And so I think that, he kind of wrote out all of what you have to do, when you have to be there by, which I think is much more helpful for us to understand. And I think that opens the eyes to our residents too that do this. So I think from a resident standpoint, they just have much more access to health disparities. And we require them to do community outreach as part of their emergency medicine training, just a couple events over the 3 years. Does not have to be street medicine, but a lot of them do it. They do street medicine. And I think it helps their ability to connect with patients within our walls of the emergency department, because now they know what's happening on the streets. They know a little bit more. It's a little bit more eye-opening. And so sometimes we get patients that we know are homeless and they come to our department frequently. And I think we're able to connect better with them. Yeah. And I've had, I think, more meaningful interactions with patients because they are homeless and they might not have heard of the shelter. And I'm like, oh, have you been to Hope? They're like, no, I haven't heard of that. And so then I, print out the information, talk to them about it, and then tell them that we're there on Mondays so you can see them on every other Monday. So for me personally, I think it's opened up a lot of my own, like, an experience with homelessness. And so I think I've become a better physician from that. And I think the residents experience that as well. The medical students, we have a fantastic leadership team who help keep this program running because there's a lot of behind the scenes that we have to do, especially in terms of making sure that we have all the supplies that we need, ordering more medications, ordering everything that we need. But we did a research project to kind of figure out the impact that it had on students and their ability to take care of a patient with social determinants of health or a patient experiencing homelessness, how they felt before they went to the shelter, how they felt after, what was their comfort level, did they feel more comfortable asking these questions, being empathetic, being able to meet patients where they were at. And we saw like a great change in basically everything that we were studying. Wow. And then in addition to like outside of that, just their own education, did they feel more comfortable presenting a plan to an attending, coming up with a history of physical and doing a presentation to an attending, because that's a big part of medical school too, is getting comfortable discussing what is going on with the patient, coming up with what could be wrong with the patient and then how I'm going to figure it out. Yeah. That's all part of medicine and being a doctor. And so these opportunities to have these patient interactions, especially in your first 2 years of medical school where you don't spend very much time in the hospital, I think helps develop those skills, keep students remembering why they got into medicine, because it can be if you're sitting in a classroom all day, you kind of forget, like, I did this to have interactions with people. I want to meet people. So that gives them a great opportunity to like see the patients that they're going to be taking care of one day. And then I think it just makes them much more comfortable and empathetic.
Yeah.
That's probably my next study, is to look at the empathy changes over medical school and see if experience with street medicine has made any change in that, because I'd be interested. Although one of my students said maybe it would make them more cynical because they see all the problems with our healthcare system, which I could see too. You know, there are a lot of issues with getting access to care, and that's partly why we have to have this program, is to try to break down those barriers. So
absolutely.
Yeah. So it would be an interesting study to do.
Yeah. Would you say, just from the personal standpoint, like you mentioned, it helped you understand the shelter system, for example, a little bit better, but how has it changed the way you deliver care when you're out on the street and then you go to the hospital and you're in the emergency department? Have you noticed a shift in the way that you even interact with any patient that you see? Are you thinking about things differently? Are you speaking to people differently? Like where was a shift that you saw in yourself through the work?
I think it's just more empathy for patients that come in that are homeless and don't have anywhere to go, or have trouble affording prescriptions. They say they can't afford anything. So I look up things on GoodRx all the time, which is a great program that has discounted rates for different medications, and I print out those coupons. So I think just being aware of what is out there. Again, I'm able to like refer patients that don't have any insurance to Gary Bernstein, for example. I saw a patient with dental issues, and he's been trying so hard to see a dentist, but his insurance is like not working, or maybe doesn't have it. He was having a lot of issues trying to figure out what he needed to fill out to get insurance. And I felt so bad for him, because it's so hard to navigate insurance. It's so hard to navigate the system. So I referred him to like Gary Bernstein, because they have a free dental clinic usually once a month. And I referred him to downtown, the dental office or the dental school downtown as well. So I think just being aware of because there's a lot of programs out there, which is fantastic, but if you don't know anything about them, you can't guide people to them. And I think we don't know enough about them, or we don't know that these things exist. And so, I mean, I've told my residents, my physician assistants that I work with, I'm like, oh yeah, refer them to Gary Bernstein, or refer them to this clinic. And they're like, what is that? I've never heard of that. And so then I go on my soapbox about it. But I just think, it's just so important to know that stuff. So I think it just makes me a little bit more knowledgeable, and hopefully like able to help patients a little bit more as well. And we've become, more comfortable. I think it helped me become a little bit more comfortable managing chronic medications too, and chronic problems, because in the emergency department, we usually only do acute stuff. But because I'm starting to manage some blood pressure stuff outside, or refill some psychiatric medications, I feel sometimes a little bit more comfortable doing some of that in the emergency department. Again, there's definitely limitations to what I do feel comfortable, what I will do in the emergency department versus what I would do on the street because of the barriers. But, it's made me a little bit more comfortable doing some of the stuff that I maybe don't normally do.
Yeah. Yeah. And I would imagine in the emergency department, it's probably the most fast-paced sort of environment that you can think of in a hospital. And a lot of times, like you mentioned before, you have this short amount of time with patients. So I'm sure when it's a high stress, day at the hospital, it's easy to kind of go through the checklist and not slow down. And like, you probably are more informed about what questions to ask people. So when they say they don't have access to one thing, you might recognize, oh, well, that means, you might not have access to this, this, and this. If somebody's homeless, they may also have transportation barriers. They may also have, other areas where they need support that just handing them a pamphlet wouldn't really, address the problem, or just taking the extra time to, like you said, print out a coupon or find the hours of operation for the most nearby shelters. I think that is so impactful. And I'm sure as a doctor, it's easy to get in the habit of, seeing a patient, going to the next, seeing a patient, going to the next. But it sounds like this work helps you slow down and ask the right questions and just understand people's circumstances a lot better.
Yeah, I think so too. And then it gives me the opportunity to teach that to the residents too, because it's easy, because they're usually the ones first seeing the patients, and then they come and they tell the attendings about them, and then we go see them afterwards. So it's easy for them, or for me, to be like, oh, did you ask this? Did you ask this? Did you ask this? Oh, I didn't even think about asking any of those things, because I don't do this stuff regularly.
Mm-hmm.
And then I'm like, no problem. I can go and like clarify some of that. So, and then also gives me the opportunity because they've done most of the grunt work or the heavy lifting of getting the history and giving, the physical, that I can just narrow in on the points that I want to make sure that the patient has a safe discharge or a safe place to go or know their next step. So it makes it a little bit easier because they've done from a timing standpoint, because you're right, we're very crunched for time. We have so many patients to see and not enough of us. And
Right.
our departments, emergency departments everywhere are drowning. And so you're trying to move through patients, but because, I do have that experience, and then like some of my residents do too, but I'm able to go as the next person and kind of clarify some things and hopefully help make their next steps a little bit more apparent.
Right. Yeah. Well, on that note, I wonder if there's any wisdom you would pass along to other physicians, maybe people that are earlier in their career or any that just don't do this type of work. What wisdom would you pass along?
I'd say they should do this type of work. So if they want to come volunteer with us, if they're from Corewell, they totally should. I think it's hard not to get cynical in our careers, and it's hard not to get cynical with the health system in general, just because it's, insurance is hard to navigate and there's denials and, it's been like a hot topic recently. So I think doing this free care, this outside of insurance, it just reminds you why you got into medicine and what you did this to help people and you did this to not be hidden behind, not having to we do chart, but not having to spend all your time writing notes. You get to learn people's stories and see what their life is like. And so I think it's very meaningful, and I think it makes me a better doctor. So as a young physician, if you have the opportunity to kind of do that, go out in your community and help in some way, either through street medicine or my partner, Dr. Felice, he does a lot of CPR classes for the community as well. Just various aspects where you can go out there and meet your community, I think, provide care and kind of help just, get rid of that image of mistrust in physicians and really just be there for people. I think we can make a big difference and spend a lot of time educating, and that's part of being a physician. It's a great part of being a physician. I love it, doing the education point. And so I think you get that opportunity to, not under time constraints, educate patients about something they might be hesitant about. For that one patient that we had on the street, blood pressure medication. From some others, especially at Hope Clinic, we talked a lot about the COVID vaccine when it first came out and what the studies were showing and why it was important to get it or why it wasn't important to get it. And at the Hope Shelter, they wanted everyone to get it. So, we talked about how impactful it was at that time. So I think just having this opportunity, I think for young physicians, I think is a great opportunity to kind of remember why you're doing this.
Right. Absolutely. Well, Dr. Ortiz, I want to thank you so much for your time and for sharing more about this amazing program. And we're going to, again, link to all the resources for anybody who wants to get involved. Where is the future of this program going? What can you tell us is coming up, or any exciting news that you have to share?
Yeah. So I guess from a growth standpoint, we had probably in the past year or so introduced medical health or like electronic health record. Before we were doing paper charts. So now we have Epic. So we're part of that system. So our notes can be seen by other departments, so people can see that they are having access to us. We've had the health disparity elective that we created. We do a lot of education with our medical students and our residents. But I think our next steps, we're always trying to recruit more more attending physicians, volunteers. So we've recruited some family medicine ones. We're always looking for more emergency medicine ones or internal medicine ones. And then we're going to try to expand our outreaches as we have volunteering support. So since Corewell Health, William Beaumont Royal Oak is located in Royal Oak, we'd like to expand to Royal Oak because we do have a fair amount of homeless patients that live around there too, that we do see through our emergency department. So our goal is to kind of expand to this community as well. So we've been working on that, trying to find a similar setup that we have in Pontiac with the Hope Shelter. So that's a work in progress.
Yeah, that's exciting. I live in Ferndale, so if that happens, I think I'm going to look into the volunteering. If you take just random, I don't have a medical background, but if you take just residents who are interested in lending a helping hand, I'll have to look into that if you do expand to Royal Oak soon.
Yeah, we have to figure out how to get more people involved that are outside of the medical community. We do some, we've done and do some health fairs. We've done cleanup of the streets of Pontiac and stuff like that. So those are always more welcome to people outside of the medical community too.
Right. Absolutely. Well, thank you for being here today. I should have started the conversation off with this, but you're an emergency medicine physician. You mentioned that it's crazy time right now with, I would imagine, respiratory illness. Anything you want to plug as a doctor to parents or guardians out there about getting vaccinated? Because that's a message that we've obviously been very close to, and encouraging people to vaccinate their children against respiratory illness and help protect, our vulnerable residents.
Absolutely. I think vaccinations have been one of the biggest medical improvements that we've made in the years that they've come out. I mean, between that, antibiotics and hand sanitation, we haven't made that many huge medical advances in improving longevity. So I really recommend everyone get vaccines if you can. I think especially to protect the ones who can't get them, whether they're too young to get them still, or if they have some sort of autoimmune disease, or they're immune compromised because they're undergoing chemo or cancer treatment or something like that. I get the flu vaccine, and knock on wood, I haven't gotten the flu, even though the flu has been very bad this year. I've seen a lot of flu. So definitely getting the flu vaccine can not prevent necessarily you getting sick, but getting very sick and feeling really miserable. And the flu's been pretty miserable. If you're eligible for RSV, I would totally get that. I think I'm going to get that soon in my pregnancy for the baby, to protect the baby. So I just highly recommend, we physicians, the ones that are around my age and a little bit older, we haven't seen all these diseases that we're protected by from vaccines. And it's terrifying to think that they might come back and we might start seeing them because we're not meeting our herd immunity. We're not all vaccinated. And there's a lot of negative outcomes with these things. So to prevent it, it's just the right thing to do and amazing for your child. So I know there's a lot of controversy, but really vaccines have been around for a long time and have been a huge, huge help to the healthcare system. So I would recommend
absolutely
getting vaccinated.
Yeah, absolutely. I'm glad that you were able to mention that, and it always is impactful coming from a physician who knows their stuff. You are the expert in this, and I think it resonates with people when they hear it from someone who knows what they're talking about. So thank you for being here today.
Absolutely. Thanks for having me.
With that, I'd like to thank our listeners for tuning in and encourage you head to mha.org to learn more. If you haven't already, subscribe to the MiCare Champion Cast to receive notifications when we post new episodes every month.